One of the missions of Lamprey Health Care is to meet people where they're at. How do you feel like we're partnering together for that to happen?
Well, I think that's exactly the point of the partnership. We're here in Milford, which is 15 to 20 miles from Nashua, which is where lots of services for low-income people exist. And even if those people have a way to get to Nashua, it's difficult. It's difficult for them, sometimes just in terms of their self-confidence and their nerve to get there. And having something here in a really familiar place is so important. And even if, they come and you touch them on the van and they need other services, they're much more likely to go into Nashua for those services afterwards. They already feel like they've made a connection, and that's what it's all about, I think.
Yeah, I agree. And we've seen that on the van where they partner with us out here, and then they are apt to go to Nashua for services and seen inside the walls as well.
Right.
Yeah.
Yeah, it's interesting because we do have access to lots of healthcare here in Milford. Sort of all the major players are here. And so I think there's the misconception that everybody is served by those more traditional healthcare providers. I think and we know that there are lots of people who aren't successful in those environments, and this is perfect. They can kind of come and go, and you have staff that understands this population very well and has a lot of patience and sort of forgiveness when maybe when they don't do the things that you've asked them to do, and that's really important because they don't get that everywhere.
Sure. And what are we doing that's working?
I think lots of things. One is consistency. You are here on a very consistent basis every week. Everyone knows every Tuesday you're here, and that's really important. I think if you were here once a month, that would make it much more difficult, but being here at the same time every week is really important. I think the level of care that you're providing on the van is very high. So having a nurse practitioner who can see and diagnose and treat and write a prescription and all those things is really key. It's just like a real office visit for people, which is great. I think that's great. And I think having your outreach worker here is also important. She's learning the communities here and what we're like and how we're different from Nashua, where she probably is the rest of the week, I'm guessing. Mm-hmm. And so that's really important too.
What could we do to be more successful?
I think probably a little bit more outreach, and we've talked a bit about how to make that more successful, because our clients who are coming here aren't all the right fit for the van, but there are other people in the area. So I think that's something we could work on a little bit more together. And that's not to say that your outreach people haven't tried, but I think we could maybe sort of put our heads together a little more and figure that out.
What haven't I asked you that you want us to know?
I think we want you to know how much we appreciate you being here. Working really closely with us, it really feels like a partnership. I think we touch base every time you're here, which is really important. We refer people, you refer people to us, and so I think that's worked really well, and we're really happy to have you guys here.
We're very happy to be here.
Yeah, the Lamprey Health Care Mobile van takes care of my health needs and questions, and it's been working out pretty good. I think I've been coming here a couple, 3 months, weekly, every other week, whenever it's convenient. A lot of trust with them. They're very truthful. really quite happy with it. They really feel comfortable.